Hello everyone, I'm Khalid Abdalla. I'm presenting on behalf of the A2 Quality Improvement Cohort. Our project title is Improving the Rates of Hepatitis B Vaccination in Patients with Diabetes, Hepatitis C, and HIV Infection. Our group members are Ahmad, Yasser, Abdu, myself Khalid, David, and Nooshin. Our project supervisors are Dr. Choudhury, Dr. Banderas, and Dr. Wooldridge. So a bit of background, hepatitis B is transmitted through percutaneous or mucosal exposure to infected body fluids, and it's a significant source of morbidity and mortality for these patients. Acutely, they can develop acute hepatitis, and on the long run, they can develop liver cirrhosis. So the CDC recommends that adults aged 19 to 59 with diabetes, hepatitis C, or HIV receive their hepatitis B vaccine if they weren't previously vaccinated. Having said that, we designed a prospective QI study to look at these patients aged 19 to 59 with a diagnosis of diabetes, hepatitis C, or HIV who were seen at the Internal Medicine Primary Care Clinic at Truman Medical Center over a period of 4 months. And our intervention was to improve the documentation of hepatitis B vaccination status in the EMR. And we did that by educating the residents and the medical assistants through posters hung up in the clinic and routine emails sent out to the residents as reminders. And we looked at the percentage of eligible adults who received the first dose of the hepatitis B vaccine in our intervention window, which was November 2020 to March 2021, and compared that to our pre-intervention window, which was November 2019 to March 2020. And we also broke it down based on what condition they had, diabetes, hepatitis C, and HIV. So during our intervention window, 613 patients met the criteria. The majority of them had diabetes, and we had to exclude 77 of those patients because they'd already gotten the first dose or they'd already been vaccinated for hepatitis prior to our intervention window. And we compared those patients to 806 patients who met the criteria in our pre-intervention window. And Figure 1 summarizes our results. So overall, there was an increase in the overall vaccination rate from 7.1% to 7.8%. The greatest increase we saw was in the HIV group, followed by hepatitis C, followed by diabetes. So in conclusion, our intervention did lead to an improvement in the hepatitis B vaccination rate, but our study was limited by the relatively short intervention period and lack of prior hepatitis B vaccination documentation in the EMR. Thank you all for listening, and I'd like to thank our project supervisors for their input and support.